Thank you everyone for joining us today. So as we begin, I'd like to take a moment to acknowledge that Laurier's campuses are located on the traditional territory of the Anishinaabe, Haudenosaunee, and Neutral peoples. Perhaps you're joining us from another location, and in that case, I would encourage you to take a moment to honor the Indigenous people who have lived and worked where you reside historically and presently. Acknowledging them reminds us of our important connection to this land where we live, learn, and work. We recognize, honor, and respect these nations as our traditional stewards of the lands and water. I'm AnneMarie Levy. I'm your moderator today. I'm a neuroscientist lecturer and research associate at Wilfrid Laurier University and the University Health Network. My research centers on the use of technologies and interventions to improve the quality of life of people living with cognitive impairments. This includes Cog at Work, a program of research exploring technologies to better enable employers to create accessible workspaces for employees living with cognitive impairments, and the Dementia Isolation Toolkit implementation studies, which aims to support the delivery of person-centered care during infectious disease outbreaks in long-term care settings. So the format for today is that we'll start with hearing from our two panelists and then have a conversation about items they've shared or your own questions. So please feel free to pop your questions into the question box and I'll pose them to our panelists later. You can do this throughout the entire webinar today. And so to begin the conversation, we have Dr. Meaghan Barlow and Dr. Josephine McMurray. So Dr. Meaghan Barlow is an assistant professor in the Department of Psychology at Wilfrid Laurier University. Before joining the Laurier community, she received her BSc in psychology from Bishop's University, her MA and PhD from Concordia University, and completed a postdoctoral fellow in the Emotion and Emotion Regulation Lab and the Berkeley Personality Lab in the Department of Psychology at the University of California, Berkeley. Meaghan's research interests are broad, spanning lifespan, social, personality, and health psychology. She explores the age-related structures, functions, and consequences of emotional experiences, the self-regulatory factors that protect older adults' well-being and health, well into advanced old age, as well as the experiences, beliefs, and definitions of well-being across the adult lifespan. Dr. Josephine McMurray is an associate professor at Wilfrid Laurier University's Lazaretti School of Business and Economics in Business Technology Management program. She is also adjunct associate professor in the Arthur Labatt Family School of Nursing at Western University and is the associate scientific director at AgeWell, Canada's Technology and Aging Network. Josephine has a PhD in health studies and gerontology from the School of Public Health and Health Systems at the University of Waterloo, which focused on system performance measurements using electronic medical records. She received her MBA from Laurier in 2003. Her research now is focused on issues at the intersection of healthcare technology and management, and her current grant explores the implementation of geolocation technologies in long-term care settings, employers' perspectives on the use of technology to accommodate employees that are diagnosed with mild cognitive impairment and dementia, and the use of AI in disability management. So to begin our webinar today, I'm going to turn it over to Meaghan for her presentation.
All right. Hello, everyone. I hope you can see my slides okay. I will assume you can, unless told otherwise. So my name is Meaghan Barlow, and I'm a new professor here at Wilfrid Laurier in the psychology department. Broadly, I study self-regulation, emotion, and well-being across the adult lifespan. But today I'm actually not going to talk mainly about my research directly, but rather about how I think about the concept of healthy aging and how this impacts the research I have done and will plan to continue doing moving forward. So to set the stage, I want to first speak about what aging looks like in 2022, and a little hint, it's a lot of things. So here's a graph retrieved from Stats Canada, and it's representative of most of the graphs and narratives that you would have seen and heard when people talk about the shifting landscape or the shifting demographics of Canada. And the main point that is typically made with this graph is that life expectancy has increased consistently, in that individuals born later are living longer and longer. And on average, this message is true. So by and large, individuals are definitely living longer and longer. However, in this graph, you can also see a snippet of how there is a lot of variability in this phenomenon. So more specifically, while on average life expectancy is increasing, you can also see that it varies based on sex, and that females on average are living longer than males. And this is the first point that I want to make today, is that aging is a very heterogeneous process. So in other words, it varies a lot between individuals. And this idea has been supported by research highlighting the substantial variability in life expectancy and also the conditions related to it. So this is some Canadian research that even compared indices of aging that took chronological age into account versus other indices that did not take chronological age into account. And actually what it found was that the indices excluding chronological age actually predicted mortality 6 years later better than the indices including chronological age. And beyond life expectancy and mortality, there's other research in the Canadian context that has also found variability in many health indices actually increases across older adulthood. And so these findings highlight that there's extreme variability, not only in the number of years lived, but also in the experience of living those years. And so essentially aging looks like a lot of things in 2022. And so then what is considered healthy aging in this context? And again, another little hint is that it also looks like a lot of things. So historically, old age has been seen as a time of decline, disability, and disease. Fortunately, there has been a shift to more positive views of aging, including the concepts of successful aging, active aging, and healthy aging. And these terms are often used interchangeably. And over the years, there's been many definitions of each of these concepts, but I'm just going to go over a few examples here just to give you an idea. And so, for example, successful aging has been defined as when individuals exhibit a low probability of disease, high cognitive and physical functioning capacity, as well as high social activity and engagement in social relationships. Active aging has been defined as the process of optimizing opportunities for health, participation, and security in order to enhance quality of life as people age. And finally, healthy aging has been defined as living a long, productive, meaningful life and enjoying a high quality of life. And while these definitions are definitely an improvement over the historically negative accounts of aging, the underlying theories still have some common flaws. And so I'm not going to go into detail about all of the flaws here, but I just want to focus on a few pointed out in a paper by Teeter and Chonady. And so first, as you will hear about a little bit more in the second presentation, they often fail to adequately consider the social and particularly environmental factors that contribute to the extent to which an individual can age, quote unquote, healthy. And so they focus very heavily on individual choice and effort alone. They also tend to focus on remaining free of disease and disability. And this can also be ableist in that essentially it's defining the picture of optimal aging in a way that excludes those with disabilities. And finally, they also tend to set unrealistic standards of what you actually need to do in order to be quote unquote successful. And so these unrealistic standards are also very prescriptive in the sense that who gets to decide what successful aging is for everyone, and also who is to say that there is one definition of successful or healthy aging that applies to everybody. And these standards also tend to ignore the natural changes that occur in the aging body, and in doing so imply hostility towards aging bodies. And so one final criticism or potential explanation maybe of some of these failings is that these theories fail to adequately consider the input of older adults. And this can have some important implications. So in particular, mixed methods research has found substantial incongruencies between how who researchers would consider to have aged successfully versus the self-assessments done by older adults themselves. So for one example, one study found that 92% of older adults with chronic illness perceived themselves as aging successfully despite experiencing a disease or disability. So while in the eyes of some researchers, these older adults would have been considered not to be aging successfully, 92% of them self-identified as aging successfully. And so with that, what do older adults actually think? And at this point, I hope, unsurprisingly, this Teeter and Trinity paper found that older adults think it's a lot of things. And so more specifically, they found 12 common themes that were identified by older adults as aspects of successful or healthy aging. And so just to highlight a few, theme 1, so the most frequent, the most common, was social relationships and interactions. So above all else, maintaining social connections with family and friends, having good family and social support, social engagement and participation, as well as status appreciation and respect. Theme 3, so the third most common, was being healthy, but importantly, how this was described by older adults wasn't simply being absent of disease or disability, but rather as the ability to take care of themselves, to maintain mobility, continue to be physically active, and protect both their physical and mental health. And theme 4 was financial security, and theme 8 is environmental and social policy. And these are mainly here to point out that both of these made it in the concerns of the top 10 concerns of older adults. So this further highlights the importance of structural factors and considering those when talking about healthy aging. And finally, theme 12 was actually having a good death, which is something that is often overlooked. And in this study, older adults define this as being able to die with dignity at home, surrounded by family members in comfort and warmth. So now that we've discussed so far that aging looks like a lot of things, and also healthy aging also looks like a lot of things, I'm going to briefly talk about what the implications for research and policy might be. And again, it is also a lot of things. So first, quick sip of tea. So based on what we've discussed so far, I've come up with a few important considerations, but this is by no means an exhaustive list. So the first is to define healthy aging at the level of the individual. So we want to meet people where they are and also be guided by their goals for a healthy life. Second, we want to look beyond age. So age can tell us a lot, definitely, but we should also not be looking at it as the only marker of aging. Third, consider that the environment matters, context matters. So examining how we can support older adults across different environments, for example, so urban versus rural, at home versus in a care home, etc., is definitely an important research endeavor. Fourth, pay attention to structural factors. So structural factors like social policies, racism, sexism, they not only impact the aging trajectories themselves, but they also impact access to the protective programs, which just further underlines that individual effort and action can only get you so far within these societal structures. And finally, listen to older adults. So quite frankly, they're the only ones qualified to tell us what successful or healthy looks like to them. So researchers, practitioners, and government officials should nurture communication channels and keep their ears open. And so that's all fine and dandy, but I wanted to use my own research as kind of an example of what these implications might look like in practice to kind of give you a little bit more context. And this can be seen both in the terms of the questions that you might ask, as well as the methods you might employ. So broadly, my research centers around these three questions. So how are emotional experiences and their consequences shaped by developmental context? What can individuals do to protect their well-being and health in response to changing developmental contexts? And finally, how do people define happiness across developmental contexts? So with this work, what are some of the ways that my work defines healthy aging at the level of the individual? So that was the first point. So in my work, I've integrated this idea by using a lot of person-centered approaches. So for example, I have explored the functions and benefits of negative emotions like anger and sadness across older adulthood, something that's not typically considered to be part of healthy aging. And in doing so, we actually highlight that different negative emotions are not always all bad. And what we do is we explore how variations in contextual factors within the individual are actually associated with the extent to which these emotions may be adaptive for that given individual. Next, how does my research look beyond age? So the second point. And so building from the previous example, my work on the functions and consequences of emotions across adulthood frames the questions in terms of developmental context rather than simply age. So in this way, while I have looked at age differences in levels, functions, consequences of these negative emotions, I've also used measures like perceived control, perceived stress, objective indicators of stress like cortisol, as well as health status as indicators of developmental context. Third, how does my work consider the environment? So in my own work, I've already mentioned that I have and am interested in continuing to explore the role of contextual factors across all my lines of work. However, this is one that I also plan on expanding pretty extensively in the future. So I have some projects planned to examine factors that predict pathways towards individuals self-defined version of a healthy life across different contexts. So specifically in the context of retirement homes as well as rural locations. And in fact, to do so, my whole lab has been designed to be mobile so that I can bring all my equipment to conduct studies beyond the usual on-campus setting. Fourth, how does my work pay attention to structural factors? So at the most basic level, this involves collecting the data on these structural factors, which unfortunately is not done often enough. And in addition, to me, this involves building relationships with underserved communities in the Waterloo region, my new neighborhood, to work with them in the research process in a way that benefits them in the future. And further, I'll also elaborate a little bit more on my next point, but to me, this also involves working with representative samples of older adults. And so finally, the fifth point, how do I consider the voices of older adults in my research? So there are two main ways that I address this issue in my work. So first is involving older adults in the research process and incorporating some qualitative interview style methods into our research. So for example, in a new line of research, I'm looking at how individuals differ in how they define happiness or what they need to be happy and how this varies across the adult lifespan. And core to this work is really collecting some open-ended responses to see how, without our preconceived, perhaps prescribed notions of what happiness is, how individuals define this rather abstract concept. And second, as I alluded to, is to use representative samples of older adults. So in my own work, we always try and offer in-home options, so across all of our studies, so that unlike most psychology research, our older adult samples don't simply consist of the healthiest and most mobile older adults, but also allows older adults that can't readily travel to an on-campus setting. So whether it's because of health, economic, or geographic reasons, to be included in the research process. And this is definitely vital, particularly if you want to account for that variability in the aging process. So that brings us to the end of my talk. And in summary, aging is a lot of things, healthy aging is a lot of things, and the ways this should impact research and policy is also a lot of things. So I hope you enjoy the talk and leave here with a few things to talk about. Also, if you're curious about my research more specifically, feel free to check out my website. There's more information there. Also happy to answer questions in the Q&A. And if you have any more questions after the discussion, feel free to email me and I will do my best to get back to you. Thank you so much for listening.
Thank you so much, Meaghan, for sharing about your program of research. I'm really looking forward to chatting about these points a bit further. On that note, please do pop your questions into the question box as we go along. And so now, with that, I'd like to introduce Dr. Josephine McMurray with her presentation.
Good afternoon, everybody. And I'm just going to share my screen here. And similarly, I'll hope to get feedback from everybody if you can't, in fact, see the screen, but I'm assuming that you can now. So the first thing I want to do is just thank you for the introduction, AnneMarie, and appreciate very much that everybody has come in today to find out a little bit more about this concept of healthy aging. And I'm absolutely blown away by Meaghan's presentation. Fantastic, really well done. The first thing I want to do today is just acknowledge the fact that my work is substantially funded by the Social Science and Humanities Research Council of Canada, and also through the AgeWell National Centres of Excellence. And I am also the Associate Scientific Director at AgeWell. So AgeWell is a is focused on allowing people to age more independently in place using technologies in order to do that. They have about 250 researchers, 420 partners, 1,200 highly qualified personnel who have been through the program and have been funded, and they've come up with over 170 solutions that are out in the field now, including policies, services, and novel technologies, which are helping to make older adults' lives easier. So the question that I want to start with is, when do we become old? And if I had an opportunity, I'd love to be able to throw this question out to you and see what your conceptualization of old actually is. So think about it in your head. I mean, when do you think we become old? A Pew Research study of almost 3,000 people in the US said that on average, 68 is when someone is old. But of course, there are differences. More than half of the adults under 30 say that the average person becomes old before they turn 60. And just 6% of adults who are 65 or older agree with them. And there are gender differences. You know, while the average answer was 68, women are more likely to say that a person becomes older later. On average for them was 70. So our conceptualization of what old is actually quite different. So are you old? Well, if you ask most people, you likely won't be able to convince them, as Meaghan pointed out, that even those folks who are 68 feel that that threshold applies to them. And in that same Pew study, amongst respondents aged 65 to 74, only 21% of them said that they actually feel old. And we have a lot of terminology in our literature, in our culture, in the Western culture in particular, that speaks to this issue of sort of, you know, people being older, younger than they might actually feel. So talking about people's dotage or being long in the tooth or gray haired. So it tends to be fairly negative. So, you know, this idea of not feeling old is actually not surprising. Meaghan talked about this chronological age, and that's the number of years since birth. But aging might also be biologic. So how old your body is based on things like how your chromosomes have aged over time. Ultimately, you might measure using your psychological age, which is how old you feel or behave, and where you compare your adaptive capacity and resiliency to others your age. And finally, you might even be thinking about your social age, which is this measure of interpersonal skills and your ability to fulfill the norms and expectations that particular social roles ascribe to you compared to others again. So how we think about aging is affected by all of these things. However you look at it, though, by 2035, Canada will be considered a super aged company, which is where more than 1 in 4 Canadians will be over the age of 65. And the population aged 85 and older is one of the fastest growing age groups. They're increasing by 12% since 2016, which is considerably above other age groups, and some of which are declining. And the reality is, again, that while most people are pretty healthy throughout their lives, the need for, and thus the cost of care after age 60 rise significantly after the age of 80. They also have the highest per capita spending on health services, about almost $7,000 on average, and almost 22 for those who are over 80. And you'll notice that women, the red line, actually have higher average costs over 85, which is likely accounted for due to the fact that women tend to have lower incomes and generally experience more chronic illness. So, the healthcare and social costs of aging are definitely rising. Seniors account for almost 44% of provincial and territorial healthcare budgets, and unpaid care provision costs Canada on an estimated $1.3 billion in productivity losses each year. And that is people who could be working who can't, either episodically or who have exited from the workforce because they are caring for others. So with few exceptions, most governments and industry are unprepared for the economic and social impact of these changes. Investing in and supporting healthy aging, as Meaghan referred to, is believed to be one approach. And healthy aging, which the World Health Organization has defined as a process of maintaining functionality, so to enable well-being in your older age, that has become a priority for Canadians. Functional ability refers to health-related attributes that enable people to be and to do what they have reason to value. And it consists of your intrinsic capacity of the individual, so what you're able to do individually, and then the environment that you're in and how those intersect. A nano study in 2021 indicated that approximately 9 in 10, almost 92% of Canadians support government investment in programs that enable healthy aging, indicating a desire by many Canadians to actually extend their functional ability. The fact remains that as the population ages, governments face rising health and social care costs. These are the red and blue lines that you see here that I've just put together as sort of showing the increasing costs across the healthy aging life course. So going from healthy through to, as you age, through to less healthy characteristics. So increased longevity and equally important healthy aging are dependent on maintaining functional ability. And as functional ability declines, individuals risk poor quality of life and negative health outcomes. Encouragingly, most declines in a person's functional ability as they age can be delayed using targeted individual and population health strategies and innovations. Intrinsic capacity may even be increased by the adoption of healthy behaviors and prevention of multimorbidity. So even though diminished intrinsic capacity is inevitable in aging, the progression and rate of decline can be slowed and these functional abilities prolonged. And my research, which has been funded by AgeWell, focuses on the impact of technology-enabled or age tech solutions on the social and health-related costs of care. So an AgeWell study in 2019 found that 8 in 10, almost 80% of Canadians 65 and over believe that age tech can help them stay safe, independent, and in their homes longer. While 7 in 10 said that they'd pay out of pocket for technology that would help them to age in place. And the AARP, in fact, actually termed this, they sort of termed this age tech early in 2019. And they have said that this will, age tech will actually eclipse increased spending on all other products by 2050. So these technologies are expected to help reduce the burden on our health and social systems by helping to shift health service delivery from expensive institutional care settings into the community, helping older workers to stay on the job longer, reducing the burden on unpaid care partners, improving working conditions for healthcare providers, and stimulating economic growth and job creation for small and medium-sized business who get into this enterprise space in the age tech sector. We also need to understand that many stakeholders involved with age tech use are not just the older adults themselves who might be purchasing technology. Those tend to be early adopters who tend to be highly sophisticated users. There are also individuals and institutions that are purchasing technology to care for or deliver services to older adults in their sphere of care. It might also be younger family or friends who are purchasing or influencing the purchase or adoption by any of the previous users. And of course, we have to be prepared for and to think about future users who will be more digitally savvy, but who will have to navigate increasingly more complex and busy technology options. And in case you're skeptical about whether older adults themselves are technologically ready, one of our Environics polls that we conducted with over 2,000 Canadians over the age of 55 showed that 76% self-report being confident using technology, and a majority are willing to pay out of pocket, particularly if it helps them to age more comfortably in place. This is a natural segue into sort of how we might sort of look at different technologies. So in 2018, we conducted a comprehensive review of policy priorities related to older adults across governments in Canada and internationally. And the priorities were validated with input from researchers, government, not-for-profit, and industry stakeholders. And true to the age-well way, similar to what Meaghan has pointed out, all the work we do is with caregivers and older adults themselves. So we came up with a short list of 18 challenge areas. We got feedback from across the stakeholders in Canada, and we came up with these 8 priorities areas. And since that time, we've been focusing on these priority areas in order to be able to support research and technology-enabled solutions for older adults. And that can include things like, being validated across the living circumstances in Canada. So from active living, where we have traces that look at constant and continuous monitoring of all vital signs, using medical grade smartwatches, through to the Tenera platform, which is uses sensors to monitor residents and perhaps staff and visitors in care settings, and then right through to long-term care, where you might be using devices that help a single provider to transfer someone to get back from bed, or it could be as simple as being in home care, where you're actually using robotic carts to help you go upstairs. So I just wanted to quickly run through one particular grant. I know I'm going to run out of time shortly, but one particular grant that we've just in the process of completing. This is the Space-Time Indices for Clinical Support, called STIX. And we're looking at how we can accelerate the use of RTLS technologies in improving health and well-being for older adults who are living in long-term care. And this addresses one of those challenge areas of healthcare and health systems. And so what we did is we did some literature reviews. We have 2 locations where we have tested these systems, a locked dementia care unit and a long-term care home. And the scope of what we're doing there is actually looking at the barriers and enablers of technology adoption, and then looking at the clinical value of contact tracing or monitoring on behaviors and health markers. So we can actually look at this data and see whether or not we can get clinically relevant data from tracking people's location in real time. So what this means is what real-time location systems are a wearable. It's that little watch that you see in the bottom of the middle of the screen. It has a sensor which is picked up by a beacon, which is located throughout the facility, and then that interacts with a tablet or a screen or even a smartphone, where people are able to track the activities of the location of people in a space. And what we found, of course, that, we, in our lit reviews, that the RTLS are being used for many applications in healthcare, but it's very, very early on, and there's little evidence of its clinically meaningful information that you can get from it. But we are actually in the process of testing that in one long-term care setting. We also found that there were lots of factors that are affecting the implementation and uptake of these types of technologies, and things like that are getting in the way of that are just a lack of motivation for engagement. In long-term care homes, people are so busy. You have to have really good value from your technology for people to see value in them, to buy them, and to adopt them. There's oftentimes little infrastructure to help with that. And people oftentimes have expectations, myths that they believe about certain technologies that are not always true. So there's always also a sort of a lack of consensus on agency and privacy in these new wearables, and actually in tracking resident substitute decision makers and staff in these organizations. Secondly, we have to look at some enablers of implementation, understanding workflows and policies and technologies, getting older adults, their substitute decision makers, and staff involved with the design of these technologies so that they can be user-centered and can be sort of more ubiquitous in their universal design. And then communicating everything that you're doing with people to bring them along in these as you help them to adopt these technologies, and certainly establishing policies and frameworks that help with that. So I'm going to cut that off now. I know I am at the end of my time. So thank you so much for listening to this particular presentation in our workshop today. And if you have any follow-up questions, I'd be delighted to chat with you about them. I'd be delighted to give you more information about the different projects that I have underway that's looking at healthy aging through the adoption of and sustainment of health tech and age tech. Thank you so much.
Thank you so much, Josephine. So Meaghan, I'm going to invite you to turn your camera and mic back on. And so we've had a few questions come in, so I'm going to jump right into them now. So to start with, our first question comes from Simon. He says, it's great to see all of the work on aging and longevity. He says, financial service institutions have socialized us to think about being old as 60 or 65, and that we should retire at that time. We see retirement as a period of decline. However, due to increasing longevity, we could have 10 or 15 to 20 years of healthy lives. So is it retirement or a second act? FSIs don't focus on the non-financial side of retirement planning, so oftentimes we still hold on to an archaic notion of retirement. So wondering what your thoughts are on this. Are you working with any financial service institutions to influence how they portray retirement? That's open to either Meaghan or Josephine to jump in.
I'm happy to jump in, and then I'll hand off to Meaghan and to have her thoughts. So, you know, what we know is that many governments, because of some of those costs of care and social supports, are looking at increasing or sort of increasing the ceiling for entering into that retirement phase where you get government support, and so we are looking at more people potentially being in the workforce. We know that over the last number of years, there's a large proportion of the population who are ill-prepared to be able to make that leap into retirement financially. And so I think as much as it could be seen as sort of that second phase, most definitely we are looking at technologies that help people, even if they are not able to virtually travel and to move into that second phase. But we also have to look at how we make workplaces more accessible to older adults who must or choose to work longer. And what we know at the moment is that workplaces tend to be ageist, not just for older adults, but also for younger, but in different ways. And we know that for older adults, workplaces can be not the friendliest places to be, particularly when you think about ability as being a continuum over the lifespan, where you tend to have more disability as you age. So our workspaces are not well aligned with that. And I just to mention before I hand over to Meaghan that the federal government and federally controlled industries are actually now have to adhere to the Accessible Canada Act, and they are all working towards having accessible plans for their workplaces by 2030, which is part of the Act. So this is making a sea change, particularly in the government, who are actively looking at how they can make workplaces more accessible so that older adults who want to continue working and choose to or have to can do so comfortably. And I'll hand over to Meaghan now.
Yeah, so I mean, the financial side of retirement is definitely not my expertise, but what I can speak to is kind of the psychological experience of retirement. And maybe unsurprisingly, my thoughts are my thoughts on it are that it's a lot of things. So what we see with retirement, so not only do across the lifespan when people think about retirement, I think as you kind of progress through your life, there tends to be trends in how people view retirement. So a time to look forward to, a time to dread, etc. And what we find too of once people in that transition, I think a lot of people are surprised by how difficult that transition can be. And it depends on a lot of things. So I think there are some kind of societal shifts that I think may impact this in the future. So for example, the extent to which your job or being part of the economic complex is a part of your identity. I think some people really struggle to find themselves without that. So that's something that we may see a sea change over the years as well, as people kind of are identifying less with their jobs. But also I think one of the things that tends to predict how well people do, so if you kind of thrive in retirement, tends to be finding something meaningful. So now that you don't have 40 hours a week taken up by your job, what else can you do? And those who struggle tend to not do much with their time, feel a little aimless. Those who thrive tend to find organizations to volunteer with, tend to become engaged in their community, and things like that. So I would definitely love to see that kind of messaging when people are talking about retirement and how you can kind of capitalize on this time, as now that you have all this free time, do it, fill it with things that will bring you joy and bring you whatever your happiest life is for you.
Those are excellent perspectives. So I just want to encourage everyone at this point to add your questions into the question box for the next set of conversations. But the next question here is that, is there a phone that's been developed for people with dementia that's user-friendly? Perhaps Josephine, you want to chime in here?
Sure, and I see Meaghan nodding as well, so she probably has some thoughts on. Okay, so yes, there are. I know. And again, it's sort of the ageist. The jitterbug is one which continues to be one which is available. There's something called the RAS memory cell phone that is built specifically for people, RAZ, who have dementia or Alzheimer's. And there are other features which, can be enabled on your phone to, on regular phones, to help those who are who have dementia or mild cognitive impairment, Alzheimer's, to help them with that technology. But I think it's as with all aging and all health associated with somebody's age, it is so very personal. I mean, we call it an N equals 1. So, I mean, it is individual. What might work for one person who has dementia might not work for someone else. So, trying out these options to see whether or not they work for somebody. If you've got a loved one who you'd like to have access to a phone is one thing. The other thing that I did was to install an Amazon Echo. I know that it's controversial. I actually don't have them in my own home, but I installed it in my mother-in-law's home, and she has some memory issues. And that was a little easier for her, rather than being confused by buttons and having to remember how to put together sequences. So being able to speak once she got the hang of it was easier than actually using a phone. And you can use the Echo in that way.
Excellent. Thanks, Josephine. So the next question we have here is for Meaghan. So you mentioned the 4 areas of aging. Do you have any suggestions or research that looks at managing the challenge of supporting someone who has a cognitive impairment, such as dementia, having an unrealistic perception of their healthy aging? So for example, psychologically, a person living with dementia may feel healthy, or that they don't need support yet, but chronologically and biologically speaking, but that's not actually the case.
Yeah, that wasn't I didn't actually mention the 4 aspects of aging, post Josephine. But that being said, I can somewhat speak to the caregiving experience in the sense that in my work, we have looked at, there's obviously many factors, many individual differences or strategies, techniques out there. In my group, we've looked at a few things, including goal adjustment capacities is one. So essentially the idea that it's not necessarily the rosiest picture though, but the idea that sometimes when you're a caregiver, what is actually most adaptive and most important is being able to know when and being able to let go of certain goals. And obviously, if this is a loved one, that doesn't mean letting go of taking care of your loved one, but it may mean that you kind of have to let some peripheral things in your life go to be able to focus and not overburden yourself. And relatedly, to not use a different type of strategy called goal re-engagement, or maybe limit it, which essentially involves adding more things on your plate. So I think the overall message is essentially that it really is tough. There is, like Josephine was saying, it's N equals 1. It's really individualized what the right thing would be. But I think have compassion for yourself. Self-compassion has been shown to do wonders in these contexts as well. So have compassion for yourself. Your experience is valid, and I hope that you can reach out to maybe your social network and try and get some external supports, either friends, family, doctors, etc.
Excellent, thanks. And so the next question that I have for you is related to retirement again. Retirement is seen as a death sentence. Is this still a valid statistic that people deteriorate and even pass away shortly after retirement? Also, are there supportive people or organizations to help transition people from work to retirement? Many people at this stage are dreading it and worrying. What will I do with myself? How will I fill my days and still be relevant? Josephine, or Meaghan, go right ahead.
I can go first, and then I'll swing it over to Josephine, because I imagine we both have some thoughts. So there definitely is kind of like an average trajectory that you see with people. That being said, that research at this point was done a good amount of time ago. So I don't know what the most up-to-date, quote unquote, average trajectories would look like. But like I said, there is a lot of variability in this experience, in this transition. It is a very life-changing transition, especially if you're going from full-time work to no work. It can be very shocking. And I think people are often surprised by how quickly they're like looking for something to do. And so my advice essentially would be to take the time to relax, recoup, but also just think about what would bring you joy. What is it that you want to fill your time with? Now that you have this extra freedom, what is it that you would like to do? And so kind of capitalize on the experience. And that might be continuing to work either at your existing job. Maybe you don't want to retire yet, or maybe it's finding a different job. I always talk with my mom about how when she retires, she wants to go work at a small bookstore. That's like her life goal, to work 20 hours a week at a small bookstore once she's retired. But maybe it's, again, a community organization or just something to fill your time. And I think that's probably the biggest piece of advice I have for people in retirement is take the time to relax, but also truly think about and implement what you want to fill your time with.
Absolutely. Finding a sense of purpose is so important. Josephine, did you want to add to that?
No, absolutely concur with everything that Meaghan has said. And also to say that, you know, I'm not aware of any organizations which help with that transition from work to retirement. It's always kind of been, as I understand it, kind of you're on your own. So using some of those strategies that Meaghan has mentioned, being kind to yourself. You know, the other thing too is, you know, for those who have the time, who are in the audience, is plan for your retirement. You know, there's nothing worse than finding that retirement is there and suddenly, you know, realizing you maybe can't afford to retire, or that you, you know, you just don't have a plan. And so you're suddenly retired and really left on your own. So again, you know, having a purpose for sure, but making sure that social connectedness is still there for you, because there's one of the key markers for us on successful and healthy aging, as much as you can, is to be able to remain socially connected in a way that feels comfortable for you.
Absolutely. For both of you, does either of your research include Indigenous peoples and perspectives related to aging and elders? Maybe let's begin with you, Josephine.
Happy to. So in my particular case, it hasn't specifically, but I can speak to the work that we do at AgeWell. We actually purposively have scholarships for Indigenous researchers. So not only looking at Indigenous communities, but also making sure that we're building the capacity of researchers who understand traditional ways and who can relate to Indigenous communities. But we are also making sure now that we are ensuring that research dollars are going towards the exploration of technologies and the context in which they are introduced to Indigenous communities. So thank you for that question. It's one which we are very aware of as we go into our next phase of granting for keeping the research institute alive. And it's some of the feedback that we have gotten is that this is so important. So I very much appreciate your bringing that forward.
Meaghan?
Yeah, so I am brand new. I started July 1st, and previously all of my work was with archival data. And so unfortunately in the past, I have not had the chance to. That being said, it's something that I would be extremely interested in. And so if that is something that the community would benefit from and be open to, then I will continue to look for those opportunities in the future, and fingers crossed it all works out. Yeah.
Excellent. I just wanted to mention, someone popped in here to let us know that there are some organizations that specialize in transitioning from workplace to retirement, and they're often provided by the actual employer as part of their severance package. So just as a note for anyone who might be interested.
Fantastic. Thank you so much for putting that out there. Wonderful.
So our next question comes from Myron. And so as an older person hangs on to their jobs, sometimes because they have not become adequately prepared for financially, or for example, the economic system is not prepared for their retirement, they don't have enough money to retire. How are we able to enable older persons to participate in the economic system while valuing their wisdom, but at the same time allow young people to enter the job force and have upward mobility and also find a place? Perhaps let's start with Josephine on that.
Oh, sure. Okay. Yeah, so I think this is a really great question. And, we sit in a real position of privilege, and I acknowledge my privilege. And for much of the population, this idea of our retirement is an unreality. And for others, as I said before, it can be something that just creeps up on them. So when you're thinking about making workspaces more accessible for older adults, there's a really fine line between sort of age-friendly workspaces and ageist spaces. I think if you are an aging boomer, you're not a digital native, but you're highly, motivated to stay at work, and you've been highly educated, and so your ability to be able to negotiate that workspace, even if it isn't age friendly, is probably higher. But for other people who have not had those kind of privileges, and perhaps where their job relies on their being physically more capable or physically more active, that can be really a non-starter. They can't stay in the same job. So one of the things that you should be aware of is that, these what we call morbidities or illnesses or deficits, particularly when it comes to what I do my work in at the moment with AnneMarie around cognitive impairment, is they are considered a disability. And so if you're in a workspace, it is something which your workplace should be attempting to accommodate in order to be able to allow you to continue work if you wish to, and if you can perform the roles associated with some job that both you and your employer agree you can do. So that accommodation process, either informal or formal, is something that workers can start to have a discussion about, because your disabilities with aging can be accommodated. And depending on the industry, the size of your organization, the legal requirements for accommodation are perhaps higher or, or lower. But it's something that, if you're wishing to stay in the same job, you might want to discuss with your employer. And we know, however, how difficult it is to disclose these kind of issues. And again, I won't take all of Meaghan's time, but I'm happy to discuss that offline with anybody who has any further questions. And I'll cede the floor to Meaghan.
Meaghan, I actually wanted to ask you a couple questions about your research. So you mentioned the potential functions and benefits of negative emotions like sadness and anger across the lifespan. Can you elaborate on the value there?
Yeah, so essentially this work comes from the merging of two fields. So the first is functional approaches to emotion, and the other one is lifespan psychology. And so functional approaches to emotion essentially say that emotions have functions. So evolutionarily, these emotions, they've stuck around. We express them, we experience them because they serve a purpose. And so merging that with lifespan psychology, which kind of looks at how things vary across the lifespan and how the different trajectories life can take, putting those two things together, essentially, we argue that the functions associated with different emotions, the extent to which those functions are adaptive, changes across the lifespan as your context changes. And so some of the work that we've done, we've largely focused on sadness and anger, and I won't get too into the weeds here, but essentially the kind of overarching picture is that sadness can actually become relatively more adaptive in old age. As you're experiencing various constraints and things beyond your control, sadness is actually thought to help you disengage from those uncontrollable things. Whereas anger is thought to be relatively more adaptive in younger adulthood because it's thought to be associated with persistence and fighting and continuing to strive, which is most adaptive when most things are within your control. And so essentially, how adaptive these things are can vary across the lifespan. The one thing that I always feel like I must asterisk next to that is these are discrete emotions. So this is when an emotion is coupled with the situation. So something happens, you feel something, you react, not chronic emotion. So this is not chronically feeling sad. That would not serve the same function and not have the same consequences. So yeah, I just really like that work because I think in general, when it comes to aging, one of the big things that you're told, or just life in general, negative emotions are bad. And I vehemently disagree. So, yeah.
That is some very insightful distinctions between the two as well. Josephine, we talked a lot about technology as well. Can you kind of address what sets age tech apart from other technologies that everyone can use? What's so special about it?
Yeah. So the only thing that's really special about it is that it is technology where it's deemed to have some impact on older adults, their ability to cope, to age longer independently in a place of their choice. So there is a huge growing economy associated with age tech, obviously because of boomers moving into a space where they are possibly more challenged in their living and spaces. And so so that's what I would sort of, I would define that as being really sort of, a technology which is which understands what the needs and wants of older adults, has been co-created from an early stage with input from older adults and their stakeholders like care partners, and aging technology which is accessible, affordable, and that is easily used, has reasonable interfaces. All of those things help to define age tech as sort of its own domain. Okay. But it could be applied to housing, age-friendly communities, transportation, across all sectors.
Awesome. Okay, thank you so much. Well, I want to be respectful of our time. We're nearing end here. So Meaghan and Josephine, thank you so much for participating. It was a pleasure to speak with everyone. If anyone has any additional questions, feel free to email either Josephine or Meaghan directly or the organizers, and we can pose those questions to them. So thank you for having attended today, listened and posing your questions. We will be sending a link to the recording as well as upcoming conversations in the next few weeks. And we hope you'll join us again for our future events.